In my playbook tonight, I want to look at the American Medical Association and its historic role in helping really block healthcare reform in this country. The AMA is the largest physician organization in America. And back in 1961, the group hired Ronald Reagan to be the spokesman in a campaign to block Medicare. Here's how they fought it back then. Remember this?
My name is Ronald Reagan. One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. All of us can see what happens once you establish the precedent that the government can determine a man's working place and his working methods, and behind it will come other federal programs that will invade every area of freedom as we have known it in this country, until one day we will awake to find that we have socialism.
Are you kidding me? We should have led the show with that. That clip you just watched was included in Michael Moore's Sicko. Now, today, President Obama took the fight straight to the critics. He spoke to the American Medical Association.
When you hear the naysayers claim that I'm trying to bring about government-run health care, know this: they're not telling the truth. What I am trying to do, and what a public option will help do, is put affordable health care within reach for millions of Americans.
Joining me now is Sam Stein, political reporter for the Huffington Post. He's done some extensive reporting on the history of the American Medical Association and how they have fought health care reform over the years in this country. Sam, do you think the president made any headway at all today with the AMA?
It's a great question. I was talking to a few observers of the healthcare debate who say that the AMA could potentially come on board a public plan, but it would have to be so watered down so as to make the public plan virtually ineffective. That said, about 60% of doctors say that they support a public option for health insurance, and any time that the president can take the case directly to them, he can peel a few more off and he can diminish the effectiveness of the AMA. I know that one member of the AMA actually blogged for the Huffington Post, said he was so sick of the fact that his group was out against the public option that he was thinking of quitting. So I think there is a fissure there. I hope Obama's trying to take advantage of it, and I think that's what he's trying to do today.
Are they going to be as aggressive behind the scenes as they were with Ronald Reagan's audio in that most recent commercial? Well, not most recent, it's 40 years ago. But the fact is that they were pulling out all stops back then. What are they going to do now?
That was some scary stuff in the Reagan days. You know, ironically, the term socialized medicine, which was talked about with your last panel, is reported to have originated with the AMA when they were trying to defeat FDR's efforts to put medicine into the Social Security Act in the 1930s. The problem with the group right now is that their clout is greatly diminished. I think there's about 250,000, roughly, physicians in the group. It's not a vast majority of the physicians worldwide, and the members tend to be older or college-age students. So their lobbying clout, their political clout is diminished. I know that progressives would like to have them be quiet a little bit, or maybe be on board the president's plan, but they're not entirely concerned about their opposition to the public option at this point.
In the entire arena, Sam, how much clout does the AMA have? Are they as strong as lobby a group? Do they play for keeps? Could they make some real trouble for Obama if they want to?
Sure. I mean, I think their clout is more in terms of who they are and what they represent than it is in terms of actual congressional pull. I mean, these are physicians. They are well-respected members of society. My parents are doctors. They are very well-respected as well. And you get a sense that if a physician is against something, you trust your doctor. Obama said it today in the speech. I want to do what you tell me to do. And so if the doctor's out there saying, well, we think a public option is a bad idea, well, then there's some sort of pull there because you do generally trust your physician. But they don't have the numbers, and they don't have the resources that they used to marshal against the Clinton plan in the early 90s. And so on the Hill, people are not as worried about it this time around.
Sam, thanks for joining us tonight. You
No
see
problem.
breaking news there.